Okay, antibiotic resistance. Now this is something that we see a lot. It's a growing problem, and it's where bacteria are starting to evolve and they start withstanding the drugs designed to kill them. So this mainly occurs due to overuse and misuse of antibiotics, such as taking them for common viral infections like a cold, sinus infection. We see this almost every day. Patients coming in saying, my last doctor gave me a Z-Pack, I got amoxicillin, it's the only thing that works for my infection, and I need a prescription. So what happens is patients have a viral infection, they come in, they're insistent on getting antibiotics, and honestly, some patients will wear the doctor down and they say, fine, just take the prescription, but that's not really the best course of action. So the key is only to be using antibiotics for what we suspect to be bacterial infections. If you have a viral infections, antibiotics won't work. But you say, hey doc, they worked great last time. That's probably because the viral infection is going to last 5 to 7 days. That's the course of the antibiotics. You would have gotten better anyway. So what do we do? How do we combat this resistance? We have to be judicious and use antibiotics only when we suspect a bacterial infection. Make sure that your healthcare provider that's prescribed the antibiotics. So many times I've had patients coming and saying, I'm taking my dog's antibiotics, I'm taking my friend's antibiotics, I'm taking my children's antibiotics. Do not take anybody else's antibiotics that weren't prescribed to you. And then there's just always the common sense to be trying to avoid infections, right? So just good hand hygiene, wearing masks if you're around somebody else who's sick. Just try to avoid getting sick best you can, sharing drinks, etc. So basically the bottom line is a lot of the infections that you'll come and see your family doctor about are often viral infections. So many of your infections are viral. So we typically do not prescribe antibiotics unless they're going on for a certain period of time, or in younger kids. Sinus infections, 99% are going to be viral. Anytime you have a cough and with a runny nose and a sore throat, it's almost always going to be viral as well. So just be careful. You don't need to see the doctor every time you have a sniffle or congestion. It's typically going to be viral infections. And as physicians, it's our job to be careful prescribing, only prescribing if we think an infection is bacterial.